Bill Tomac, and I'm 6 feet tall. Hi, this is John. How can I help you?
Hi John, this is Liz calling from Novartis. I think we've spoken once before. Judy recommended I speak with you about some important information. Are you one of the nurses there?
I am Dr. Barlow's nurse, yes.
Oh great, I'm so glad I got in touch with you. I'm calling to share an update that may pertain to some of your patients with chronic kidney disease.
Oh, okay. What is the update?
There's a dosing update to Flexitrab. Are you familiar with Flexitrab? It's a relatively new therapy for patients with chronic kidney disease.
I am somewhat familiar, yes. But this is probably something you should speak to Dr. Barlow about.
Okay, yeah, sure. I would love to speak to her. I've been trying to reach her over the phone and it's been challenging. What advice can you give me? How would you recommend I get in touch with her?
Actually, she just started meeting with reps virtually. Our office manager can get that scheduled for you. Want me to transfer you to the office manager?
Yeah, sure. What is his or her name?
The office manager is Betty.
Okay, great. I will go ahead and try to get that scheduled with her. Before you transfer me, though, I'd like to ask you, John, do you know if any of your patients with chronic kidney disease are currently being treated with Flexitrab? I want to understand how relevant this dosing update is for your clinical team.
Yeah, I think there are at least 1 or 2 patients on Flexitrab. I know Dr. Barlow made a switch on one patient.
Okay, do you think that might have been because there were signs of disease progression?
Yes, I think labs were probably a bit elevated.
Okay, that makes sense. I know our Novartis team has shared with Dr. Barlow some clinical data that shows Flexitrab is recommended in patients who show even subtle signs of disease progression, such as a 5% decrease in kidney function.
Oh, okay, yeah. When PTS have shown some change in kidney function, we might up the dose of their current med and ask them to come back into the office for follow-up within a month.
When adjusting medications, you always want to monitor for adverse events. As a reminder, the most common AEs seen with Flexitrab were hyperkalemia at 8%, headache at 10%, and dizziness at 8%.
Yes, of course. We make sure to educate our patients on AE management.
That's great that you take the time to educate your patients. You had mentioned having your patients follow up in a month. What about those patients who might not do well with their follow-up appointments? What if by the time they come back into the office, they've experienced some permanent damage? That can occur in as little as 3 months' time, right?
Oh yeah, it absolutely could, but we don't have too much control over that. Oh, and Dr. Barlow just stepped out of the room. Do you want me to try to grab her?
Yeah, sure.